Hello, everyone. This is Bonnie Accorda from Ontario, Canada, and we're on a podcast series interviews with some of my guests. And for those who know me, I'm a retired animal doctor from Canada. I live in Ontario, Grimsby, near Niagara Falls. So today we have a guest from the Philippines. We have Dr. Alex Ibay. He's a medical doctor, a human doctor. And I'm going to turn the time now to Dr. Alex. But first things first, thank you so much, Dr. Alex, for giving me the opportunity to do this and do our podcast series and as one of my guests today. And Doc, I'd like to turn the time to you and tell us about yourself.
Well, thank you so much, Doc Barry. Well, I'm Dr. Alexander Ibay. I'm family physician, presently practicing here in the Philippines. Well, I'm also an integrative medicine practitioner. The reason why I become interested in integrative medicine because, uh, you know, patients here in the Philippines, they want instant relief. And when I studied acupuncture, well, that's the time that those patients who do not get well with other doctors, when I applied acupuncture to them, wow, lo and behold, they get instant relief. So from that time on, I got interested with frequency medicine, homeopathic medicine, acupuncture, reflexology, and all those things. Yeah, and then I'm actually practicing more than 25 years of integrative medicine. And so far, I'm very much content with this. Not, not, you know, I will also, I'm very active as a family physician.
And
Well, that's it.
where are you located, Doc, in the Philippines?
My clinic, we are actually located about 6 hours away from Manila. Six
Oh,
hours away from Manila.
down south. Okay.
Yes, south.
Oh, okay. Wow, that's amazing. Can't wait to go home.
Mhm.
So Doc, so your practice is integrative medicine and you finish your medical which medical school did you go in the Philippines?
I graduated from UST, University of Santo Tomas,
Oh,
UST, year
okay.
back 1983.
Wow. Wow. Historical.
So I'm just about to retire.
Wow. I hope not, Doc. And
Uh,
you still be a big part of the family of Prive International in the
well,
Philippines.
hope so. I hope so.
Yes, and yeah, UST, University of Santo Tomas, is one of the oldest university in Asia. In
Yes,
fact, it's the oldest in Asia. So going back to
yes,
the
it is.
question, Doc, how did you found about iTeraCare? How did you know about this frequency device? And one of that frequency devices on my back right now.
Yes, actually, it was. I saw it in Facebook.
Oh, okay.
Okay,
Social
and
media.
I saw it in Facebook. Then I saw the device, iTeraCare. So it's about this is terahertz frequency. So I researched first
Oh,
about terahertz frequencies. As a medical doctor, we are always skeptical about these things. Although I was using before these negative ion generators. This have you heard about the biostoppers?
mhm.
Yes, uses also frequency. I have used these devices, this actinic laser. It's invented by a Filipino, but it uses frequency also. So and then uh, from I researched first, and then I ordered a device from a distributor, and then I started to use it in my clinic since July 2022. Since
Wow,
July 2022,
last year.
and actually. The first time I used it, it was a problem about pain,
Mhm.
discomfort, lower back, and then the knees. So I tried it, and lo and behold, after about 15 minutes, 30 minutes, they get instant relief.
Oh,
Uh, you know,
wow.
some there's one time when a patient came it came inside the clinic, and he was being lifted by a companion. And then so it says, just try this device, okay, for you. And now, after 15 minutes, after 30 minutes, well, during the time, because I'm using the classic, sorry, I'm using the classic. After 30 minutes, I was looking for the patient. Where is he now? Because when he came to the clinic inside, he was being lifted by the companion. And then my secretary said, Doc, the patient walk, going to the vehicle, the tricycle. We call it here the tricycle. You walk towards the tricycle. Oh, so wow, wow, that's amazing. I said. So from that time on, I started to use it with my patients with skin problems. Yes, with lumps in the neck and everywhere. And I was very satisfied with my clinical resources then. And then I usually use it with patients who cannot, with limping extremities, cannot elevate, with difficulty in breathing, with cough. So almost, every time a patient walks into my clinic, I was then thinking, how could this device help this patient? Yeah, that was I'm thinking before. How can this device help this clinic? Help this patient. So from that time on, I tried it on even babies who was incessantly crying. So let's try. Lo and behold, after 2 to 3 minutes, patient stopped crying. And then one time, I had a patient who was with abdominal pain. He was crying. Oh, what happened to him? So, and then abdominal pain, vomiting. And then I just tried the classic for 15 minutes. After that, the patient walked towards walk, and I asked the patient, so how are you now? It's gone. The stomach pain is gone. The vomiting stopped. So from that time on, wow,
that's amazing.
I can use it almost in every patient that comes to my clinic.
And if I may ask, Doc Alex, when you were doing this and using the device, and you're only using the classic, the entry device, right? The red one, we call it the chili pepper, red one.
Okay.
Since you were using it, and you're only talking about the entry level device, which is the red one, are you using the charge water in conjunction with using it with your patient?
Well, actually, in my clinic,
yes.
I don't do the basic protocol.
Correct.
But then from not always, I give them charge water, 2 glasses before and after. Wow. But most of the time, after the contents of the container was consumed, don't have the time to make to charge another one.
That's true. And if I may ask another question, Doc Alex, is that have you seen any of these benefits by you using it to yourself, or somebody has used it for you, of any of aches or discomfort or anything like that?
Oh yes. Okay. So I used to I use it 3 times a week. After dinner, before I go before I go to bed, I usually want for I do the basic protocol for about 10 minutes only, and then I want my whatever part. Pero before, I was always having low back discomfort.
Oh, okay.
At my age, whenever I stoop down, going to the garden and do some pruning and oh, come on. when you get up, oh my God, my low back is really hurting. So from
Yeah.
that time on, very, very seldom do I experience it. And then
Wow.
I'm also having my maintenance medications for my hypertension,
Of course. Of
and
course.
and for my high blood sugar. And then I'm also medyo right now, my vision is not that good. So
Mhm.
I try to want my eyes 2 to 3 minutes, and then from that time on, I don't usually use my reading glass anymore.
Wow. That's amazing.
Not, yes, I can actually I can read my cell phone not using any glasses. not
Wow.
if not if the not good illumination or the lighting is poor. That's only the time I'm using my eyeglasses, not the just the reading glass, just the reading glass.
Wow, that's amazing. That's an amazing story. If I may ask another question, Doc, you were talking about your lower back discomfort. When you
Mm-hmm.
started doing and using that device, any of our devices for iTeraCare, how long do you start to feel the relief from the time that you're doing the wanding at your back?
Okay, so from the time I started using, actually, if I'm winding my back, I do it, just put it on the sofa and the bed and the chair,
Mm-hmm.
and
Mm-hmm.
then I just move my back
Correct,
like
correct.
this because I don't have the device for rotating device. So
Uh-huh.
if my wife is doing something, so I just do it, and then actually I don't choose it at the time that my back hurts. Just I'm just using it, and then I observe that I don't experience it as often as before. But
Wow.
not I don't use it if let's say my back is aching right now, so I'm like no, I just constantly using it, and then I experience less and less of those discomfort I used to have before.
Wow, that's amazing. That's really
Mhm.
amazing.
And then one thing more, I usually have to have cramps, muscle
Cramps.
cramps,
Okay.
leg cramps. But when I'm using the iTeraCare, oh my God, it usually doesn't have. Usually every morning when I get up, or it wakes me up, my muscle cramps. But right now, medyo lesser,
That's amazing.
or yes.
That's amazing. And that's a great testimony that you have, Doc. In fact, I could relate with you because when I was introduced to this product, to this device, I was very skeptical as well. As we, as medical doctors, I'm for
Yes.
the animal, and you're with the human. We always have that benefit of the doubt because we're trained and we practice medicine, regardless whether it's human or animal. And we always have that benefit of the doubt. And what I did, and I could relate with you because I have a severe lower back discomfort. And I've been taking narcotics. These are legal narcotics prescribed by my doctor, my orthopedic surgeon, and he gave me a bunch of so many stuff, not to undermine my doctor. He's a great guy, one of my best friends, and he's been helping me a lot. But the problem is over time, I go to a pain management clinic and I get shots of lidocaine at my back, and my family doctor found out that my liver was messed up. My enzyme was so high, and so they started asking me, "You better stop not going to the pain management clinic." Not that I'm trying to undermine my friend. He's a great guy, one of my best friends. But again, I have to be cautious because I'm in the age right now, and I'm on my age that my health is declining. But again, thank God, I'm so much grateful that I was introduced to this machine. Thankful so much, at the bottom of my heart. And for those who are watching us right now, Dr. Ibay and me as Dr. Bonnie, an animal doctor, we're not trying to say that you do this directly. What you're hearing from us is that you do it on your own. But again, we advise you to go see your family doctor. See your family doctor and see what's happening in you, and tell them about this machine. Don't do it yourself without your doctor's clearance if you're suffering from a severe condition. And we don't want you to undermine your family doctor. And this is not just part of the disclaimer that I always have in my podcast interview, is that this is not a substitute for a medical advice. We always advise those people who are asking us questions and who are watching us today, and whenever people do watch this recorded podcast interview, is to see your doctor as well, and ask them, and try to know what's your total condition. And then if it's fit for you to use this device, then go ahead. And we're not here to undermine the medical advice of all medical doctors and healthcare professionals. And likewise, me, Dr. Ibay, and me as an animal doctor, we always want to advise you to go see your family doctor first, and then, you decide. And grateful, Dr. Ibay. And anything more of any experiences that you've seen with your patients or even your family members with the benefits that they receive from using this device? Any comments, Dr. Iba?
Well, lately in my clinic, I used to have a lot of good conditions with brain injury.
Oh, okay.
Brain injury. It means with the way it may be a ischemic, that the hemorrhagic stroke. Yeah,
Okay. Mm-hmm.
and I read a book about this, about the author, that they have a facility in US. I can't remember, and then the patients they have there are either adult or child with brain injuries. No, she's a physical therapist. He's a physical therapist, and then what he noticed that every time what they do, physical therapy, rehabilitation, they always do everything for your extremities, and then they put heat, they put something like the nerve stimulator, and then he noticed that it takes too long for it to function back, to have its function back. So what they did is that they if they need surgery for the brain injured, or they do something, then they noticed that the results were good. They were satisfied with the results. So that was I'm following. Okay, so for those patients with brain injuries, I focus the iTera, the blower, on this side. If they have their CT scan results, and it will say, oh, your brain injury is here, the left side. And then the manifestation for the injury will be on the opposite side.
Correct.
Let's say, okay. So what I tell them, because during our Q&A, for those asking what to do with this condition, so I said, if you see the CT scan result, focus on the side where the lesion is, where the injury is, and then one blow on the extremities of the opposite of the injured side. And the results were very amazing, very amazing.
Wow.
I had an interview. He was a security guard, what they call here, there in Canada, security guard here in the Philippines. He had a stroke. Okay, he was confined in the hospital for 3 days. He had this large spits and he cannot almost walk. So the wife brought him back to our town, and then went to my clinic. After 30-minute sessions, imagine, this patient was asking me to have a clearance so he can go back to his work. Imagine, five sessions only. I was asking, oh no, you can't go to your work. And then he said, I am the breadwinner of the family. If I will not go to work, what will my family eat? What will they spend for other necessities? So I asked him again. I had it recorded. And I think I posted it in our iTeraCare testimony. I interviewed the patient. So the patient, I asked the wife what happened to him, and then I asked the patient, and now he can talk. The patient can talk and walk. So that means that it was effective. Very effective.
Wow.
Imagine 5 sessions. 5 sessions of 30 minutes.
Wow.
That's amazing.
That's really amazing. In fact, I had the same experience, and this was in the very beginning of this year. It could have been on the first quarter. I can't remember now, and it's posted on my YouTube. The guy who's Filipino who lives in Calauag, Ontario, he had an hemorrhagic stroke, and he had a brain surgery, and they put a metal. There's a metal on his head. That's why I can't touch his head. But when we did that, then his foot started to 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 move, and the paralyzed part was on the left side. And every time we do one thing, the part of the left side, the right side moved because that's always the manifestation. And then after that of continuous therapy, on that same day, within 10 to 15 minutes, his foot started to move. Although he's bedridden for 12 years, but that was the very first time that I've seen, whoa, what is this machine? That's why we're always called practicing doctor. I, for one, in our field, they call us practicing vet or animal doctor. And some people are asking me, why do they call you practicing medical doctor or practicing animal medical doctor? Remember, we as human beings, we do practice to learn because there's new modalities, there's new outsource of certain medical research that we don't even know yet. Until such time that now that we know about this, and that's why we're called practicing medical doctors.
Yes.
Except for God, God is the healer of all human beings. We're all created by God. But anyway, so Doc, now that you have this experience, what do you think about people that know about this thing? They know about this work, and they have the knowledge, they've seen it, but still they don't believe, and they're on the sideline.
Well, most people still have this that to see is to believe, to experience is to believe. But then, like me, I'm a doctor. Of course, let's say I was very skeptical at first. We doctors are like that because unless in medicine we all have the called evidence-based,
Correct.
evidence-based. You always look for the evidence, and if there's no evidence that it really works or this is something for this, no way, no way. Yeah, that's it. But then, so for those people who still don't, I have encountered doctors who doesn't just want them to be like me. They don't want to be criticized by the colleagues. Oh, why are you using that? Why are you? That's not even FDA registered. And then, so for me, I think it's not. First, it doesn't cause harm.
Correct.
Okay, diba? For us doctors, first do no harm. Okay,
Of course.
for us.
That's the first rule.
Then, like I said, and then I have seen it work on my patients. They get a lot of improvement. So why won't I do it? Why won't I use it? Yeah,
Right.
it can help. It can help. So I know after practicing more than 35 years, I graduated in 1983, and then almost 40 years. Tama? Right? Okay. So until now, I'm still trying to announce. When people ask me why are you still attending this, it's my passion to learn and to learn more.
Correct.
I won't stop learning. Yeah. In other words, I won't stop learning. So if I encounter these things, well, might try it, and then if I know it can help my patients, why not use it? Why not try it on them? So for those people who are not yet very convinced, well, just like what we said, just blow it, just use it, and then you can feel for yourself, and then it will help your family, it will help other people, maybe your relatives or somebody else, your friend. So don't be hesitant to use it, and don't be hesitant to share it. Share it. Let us share this blessing, di ba?
That's
let,
right.
us, let us share this blessing.
Thank you very much, Dr. Alex Ibay. Thank you so
Well,
much. At the bottom of my
well,
heart,
my
thank you so
pleasure.
much for
Well,
sharing your
actually, I'm so honored to be invited in your podcast.
You're welcome, Doctor. It's an honor for me to have you as well. And any last words, Dr. Alex Ibay, before we wrap up our interview?
Yes, like what I've said to my patients. Okay, always trust God. Trust God. Believe in yourself, and the believe in iTera. The doctor is only an instrument of God to help you. That's it.
Thank you
Just
so
blow
much.
it.
Exactly. Thank you so much, Dr. Alex Ibay. Thank you so much. And thank you for all of the things that you do in helping other people and sharing your knowledge, your medical expertise, and for sharing this device to other people as well, that those really, really do need it. And thank you so much, Dr. Alex.
Yeah, it's my pleasure. It's my pleasure, really.